You're listening to The Social Workers on WCDB Albany.
That's right. You are tuned in to The Social Workers on WCDB Albany. My name is Eric Hardiman. I'm your co-host here with Alyssa Lotmore. Welcome back, Alyssa.
Hey, Eric. I'm very excited for today's show. We have two very special guests.
Yeah, so our first guest this morning will be Dr. Neil Cervera. And I just want to check and see if Neil's on the phone. Can we hear you live, Neil?
You got me.
Great. We can hear you. Okay, so Dr. Neil Cervera is our special guest today. He's a licensed clinical social worker here in New York State and has been in private practice for over 30 years. He received his doctorate and master's degree from New York University's School of Social Work and also received a National Institute of Mental Health traineeship for forensics and addiction. He's research assistant professor emeritus from the UAlbany School of Social Welfare, and his special research interests are in the following areas: teen pregnancy and family functioning, fertility treatment's impact on couples, and inmate and family coping patterns. So today, Dr. Cervera is going to specifically talk to us about sex addiction. So, Alyssa?
Well, I'm really excited to hear this topic. I mean, it's something that we've heard in the news a lot. There's been articles about people coming out saying they're battling sex addiction. I'm a runner, and in the runner community, one of the a former Olympian just came out. Nick Willis, he came out saying he was battling porn addiction.
Right.
So I'm really interested to hear just first off, what is sexual addiction?
Well, it's currently that is up in the air in terms of, is it an addiction? Is there such a thing?
Mm-hmm.
That's number one within the science community. In terms of persons reporting it, like in my private practice or a lot of the addiction agencies at this point, people are coming in talking about being online, can't getting offline with porn. I almost thought that Alyssa and you planted a story in Time magazine this week about sex addiction. Terry Crews, who's a former NFL player, went into rehab for sex addiction, not being able to get offline with online pornography or chat room. There's been discussion about whether or not it creates the conditions for desensitization of relationships, erectile dysfunction, and so forth. So.
And what's, and this may be a tricky question to answer quickly, but in a nutshell, what's the controversy? Why is it not widely accepted that this is an addiction?
Within the American Psychiatric Association definitions, the only addictions that have been approved have been chemical addiction and gambling. Although within DSM-5, 4, and 3, and back, the paraphilias have been seen as a sexual compulsion. The truth is, I don't think that the behavioral community has come up to par with what people are reporting and what people are saying they're having difficulties with. A lot of the porn sites or the chat room sites now have gaming combined with pornography.
Okay.
So you can start off with your gaming, and then after you finish that, with getting your aggression out, you can go to lust. So. Go ahead.
It seems like, I mean, even if there's not an official diagnosis or the science community isn't saying, okay, it's not in the DSM.
Right.
But I was reading one of the articles about Terry Crews, and he's saying that, pornography really messed up my life in a lot of ways.
Right.
If days turned into nights and you're still watching, you've got a problem.
Right.
And that was me. And it seems like there's a lot going on, and it's not something that, I mean, he's sort of saying that he couldn't stop it. It was something that he was losing control of his life.
Right.
So
exactly.
when we talk about addictions, and this just happens to be sex addiction, what is it that we can, as you as a clinician, as a therapist, how do you address this?
Well, first they do a thorough evaluation about is this the major focus of their what they're defining as their addiction. Let's start there. A lot of times it could be comorbid with alcohol, marijuana use, or other chemical addiction. For starters, I look for, has there been trauma in the person's past life, whether it be sexual or otherwise. I also get a sense of when did the addiction start. Most guys are reporting to me, especially younger guys, college-age guys, that they started to look online at pornography or go into chat rooms at 9, 10, and 11 years of age, which is about what I'm hearing as well with chemical addiction at this point.
Interesting.
Yeah. I had a father here about a month ago whose son is interested in the, I don't know if it's called the WWF anymore, but the Wrestling Association. And he typed into his Google search, the boys of around 11, women wrestlers, which basically is a neutral kind of question. And up popped several porn sites for that kid.
Yeah.
On, more than what the question was about. So you have that kind of thing going on. I've had another young guy who was comorbid with alcohol abuse at 9 off of MySpace, which is the iteration back from Facebook.
Sure.
Basically get hooked into a pedophile who from the age of 9 to about 13 or 14 would send him pornography.
Oh, wow.
And that's how he learned about sex. His family wasn't monitoring what he was looking, and he was able to hide a lot of what he was doing online.
Mm-hmm.
And that's what I wonder. One of the things, online, it's easily accessible.
Right.
Kids can, you can have it in the privacy of your own home. Right. It's not something that there's really, signs or symptoms as if it was sort of like there are signs and symptoms, but compared to drug abuse or alcohol abuse or something like that, it's something that can be kept more discreet. And do you think the ease of availability of accessing these things online? I mean, sometimes I'm going on a website and something will pop up that has to do with pornography, and I didn't even know how it came on my computer. I mean, it's just, it's sort of shoved in your face, even if you're not looking for it. Right. And do you feel like that is something that is causing this sort of spike in people coming out and discussing this, because it is something that is more common now than it was before, or maybe it's just talked about more?
I in fact, in preparing for today, I was thinking about this. I subscribe to Men's Health and Men's Fitness as an old guy, not letting go of my youth, so to speak. And I remember about 12 years ago, there was this small article about guys going online, looking at pornography and masturbating 10, 12 times a day. And it kind of like blew the lid off of sort of like how frequently can men achieve orgasm. And the ease of going online is, I'm not against online. I mean, obviously it has a lot of interest in sharing and so forth. In fact, looking up articles now is a lot easier than going to the library.
Sure.
SUNY Library, or going to Pandora.
Yeah.
Right? So it's not the online issue. It's what we seek out and try to deal with maybe some of the underlying issues that have been going on in our life. Anxiety, stress from our lives, a way to relax, to go to a porn site or to a chat room or to Skype with somebody. The Utah legislature recently tried to pass a law, which I didn't think went anywhere, where porn sites have to validate the age of the person looking at the porn. But I don't know, it seems like a cumbersome thing to have to do.
Yeah. So it seems like there's multiple issues. I mean, there's certainly the content and the, the age issue and sort of maybe parenting and the legality of some of it. But there's also for adults that fall into this category that you're talking about, the issues of sort of compulsive behavior and addictive behaviors, and
our brain is trained to. I mean, our limbic system, our emotional brain. I'm sorry to
interrupt
you. Our emotional part of our brain is wired for reward, which is neutral in terms of what the reward is, whether it's going for a run this morning, or watching a great basketball game last night, or or going to chemicals or anything else, eating too much or whatever.
So as someone working with folks that are dealing with these addictions, so it sounds like you're saying that there are similar processes at work in the brain and similar processes at work in people dealing with these challenges.
Right.
How are the treatment issues similar and or different?
That's an excellent question. First is to recognize how it is interfering with the person's life. There, whether it's work, relationships, being able to soothe yourself, comfort yourself in a different way, dealing with boredom. I hear boredom all over and over again in my practice. Life is boring. Life is not happy every second of the day. Finding tools, even online, to help you sort of like divert your mind from going to a place that may be self-destructive. For example, one website is What's Up, which is an excellent website. Another one would be to something called Brain Body app as another one. Another thing is to know your triggers.
Okay.
What are your triggers? Is it boredom? Do you want to feel like you're blasted all the time, high?
Yeah.
That kind of thing.
So let's say we have a wide listenership here, and we have people in the community that are possibly driving around in their cars and listening and, maybe asking themselves or loved ones, family members, friends, questions about whether this type of addiction might apply to them. How would someone, know when it's too much and when this has crossed the line into addictive behavior?
That's a good question, too. Carnegie Mellon, about 3 or 4 years ago, said if you're online more than 2 hours a day and it doesn't have to do with your work, then you're probably depressed and or have an anxiety disorder.
Interesting.
That was out of their School of Behavioral Sciences. One thing is, how much does it occupy your life? That's one thing. Is it secretive? Is it something that's interfering with your ability to connect to people, connect to your significant other?
Mm-hmm.
Are you fantasizing when you're with your significant other about a porn star rather than that person?
Right.
That kind of thing. Is it using up not only time but money? Although a lot of the porn sites and chat rooms now are free. That kind of thing.
So a series of questions that someone might be able to ask themselves, or, for instance, if this is a family issue, maybe ask a child or a teenager or a young adult, to ask these sorts of questions to see, almost in a screening capacity, if these are even, if this is something that we should be worrying about.
Yeah, is it escalating? That's
right.
Another question you have to say. Is it simply, you start out with photographs, and now you're going to certain type of porn, but that's not getting you energized enough, and it's becoming more dangerous in order to achieve the same kind of reaction.
Mm-hmm.
But I have a question, though.
Sure.
I mean, it's a very sexualized society. I mean, you go, every time I travel down to New York City, that there's billboards and ads and everything like that. When someone, if you're recovering from a drug addiction, you stay away from, situations where you would be exposed to, the certain type of drug. But when you're talking about something like porn addiction or a sexual addiction, and when you have advertisements and TV ads and everything that's very suggestive in today's society, how do you not expose yourself, or to that type of trigger, I guess?
Well, you have to. I think that you have to divert your mind. You have to remember. I like to think that sex is part of most persons' lives. Lust is a neural part of our brain. If you're getting interested, say, in underage children as a billboard, that means you need some help.
Mm-hmm.
If you're fantasizing about Taylor Swift all the time rather than your girlfriend, that's saying something to yourself. So you have to be self-aware and mindful, if I can use that term, of what's going on in your life at that point. A lot of women are reporting, especially in the age ranges of 16 to plus, that their relationships, they can't, they cannot connect with their boyfriend because their boyfriend or girlfriend is someplace else in their mind rather than on the relationship.
Mm-hmm.
Is that helpful, Alyssa?
Yeah, that's definitely helpful.
And where do you see this going, Neil, in terms of, public awareness, in terms of, maybe the next 5 years? And I know it's hard to have a crystal ball and imagine, but do you see this as becoming, more part of the public discourse, or is this something that sort of remains in the scientific community and the treatment realm? Where do you see it headed, possibly?
Well, I think it's going to eventually... and let's start with the scientific community. There's more and more interest in the scientific community to examine this. There's been some studies using MRIs, functional MRIs, as an example, to basically see the similarities and differences between chemical addiction and gambling addiction. It seems like porn follows initially what a cocaine high would be, and also the release of dopamine and opioids and oxytocin, those good, feeling good things.
Yeah.
So there's going to be more exploration. In terms of, there's become a public awareness when you have people like Terry Crews or the other athletes coming out saying it's dangerous, it's addictive, it ruined my relationship. I also think that that there's an acknowledgement. There's a beginning acknowledgement that it's become a problem amongst a younger person, that it's interfering with their lives. Just recently, I don't know if either one of you had heard of the Skyping scandal out in Minnesota.
No.
Amongst middle school kids.
Ah, right.
Remember that?
This was one school where the entire school had been... maybe if you could... you probably know more of the details, but maybe tell the listeners.
There was a public school, I believe. I think it was a public school in which middle school...
I think it was a middle school, right.
And high schoolers were online with one another, Skyping, sexting one another. One of the teachers found out accidentally. It became for that town, a public scandal. And at first, everybody thought that somewhere there had to be an adult behind it. But as it turns out, that wasn't the case. The local prosecutor wanted to push an issue about child pornography, which was like way out of the realm of really how to deal with it.
Yep.
And I think there was a place in Pennsylvania as well where the prosecutors and the town, actually the city, took on a public awareness with young women and young men about what healthy sexuality is, feeling coerced, and took it on.
I'm glad you brought up this example because in terms of like the public opinion and view on this, even when you have situations like that where groups of individuals, young individuals, they're not really, they're exploring different things, and then when does it turn into that? How do you classify? Okay, this is a sexual addiction or a porn addiction, or versus this is young individuals doing something because they might felt peer pressure. Everyone in their class was doing it.
Right.
As parents, how do you know, okay, my child has a problem? This is not something that I can just tell them not to do. That's not appropriate. When does it turn into, okay, this is my child has an addictive problem, or this is something more than just a one-time behavior or something that they're involved in. This is something that now needs more of a treatment, more of a bigger intervention.
Right. I think you have to open up the door in terms of not about morality of it, but rather what are you trying to achieve? How's it affecting your life? Mm-hmm. Is it dangerous? And open up a dialogue about sexuality.
Yeah.
And human sexuality. Also, I think in terms of parents also need to monitor, if we're talking about younger kids, monitor what's going on the net with their kids. That guy who I told you about at the age of 9 who got sucked into MySpace dialogue ended up eventually going to federal prison because he couldn't stop his compulsion at looking at porn, and it got to be younger and younger people that he was interested in. Probably just about the age of when he started to be a viewer.
Okay.
That guy. So,
wow.
Does that help you? Does that help your listeners out there, you think, answer, open up dialogue, open up questions about sexuality?
I think that's what it is, and that's one of the reasons I was really happy to have you on the show today, because we hear about so much about I used to work in a middle school. So, you hear so much about, different things that students are exposed to and young individuals. And I liked how you just said we have to have that open dialogue about this because, with the popularity of things like sexting and just the ease of getting on the internet, posting photos.
Right.
I mean, there's so many times I see young individuals' photos, or I used to, and, they were underage, and it was like the photos didn't look like, it was more mature photos that the young individuals are posting that, 15, 16 years old. And I think that having that dialogue is so critical, aside from the monitoring, having that dialogue of saying, here's what a healthy, this is what is healthy in forming, relationships with individuals and all of those types of things. So I think that's definitely a critical component that I'm glad you mentioned.
Yeah. Every person I consult down at the a residential treatment center, and they're screened for chemical addiction, prescription addiction, over-the-counter addiction, gambling addiction, and now they're screening for a relationship and sex addiction. Because I think that if our reward system is, say, with chemicals, and you lose that and you're working a program, can it migrate to another area that may be compulsive, negative rewarding, and sort of like interfering with your sobriety and being clean in a different way? So that's happening, even though it's not being recognized with the psychiatric community at this point. So.
Yeah, well, I mean, we're running out of time, but I think this has been a great show. I definitely feel like there's been more awareness brought to it by but I was somewhat confused. I hear so much about just with the media reports. I mean, it seems like there's a lot of different things coming out about, this person has a porn addiction, this person has a sex addiction, and it's sort of like trying to balance, understand all the facts, and, here's individual situations. So having you come on and sort of give this, this is what you do, for your private practice. So having you come on and sort of talk about this and, how it sort of morphs into an addictive behavior, and sort of the triggers and what we can do to, talk about these healthy relationships and everything like that. There's a lot that, as an individual, I am now more aware of after talking to you. So I'm really grateful about that.
And if we have listeners who are perhaps, have been listening to this, we've just want to remind everyone we've been listening to a live interview with Dr. Neil Cervera, who's a licensed clinical social worker here in New York, dealing with working in private practice, dealing with addictions and various types of addictions. And we've been talking about sex addiction and pornography addictions in particular. If listeners have been, taking in our interview and listening to your words and might want to find out more information, where do you recommend folks go as a next step just to get information?
Well, for starters, you can go to my website.
Okay.
drneil.com.
drneil.com, okay.
Right. You can take an online survey that has, I have several surveys, but one of them has to do with sexual compulsivity. You could do that and get a score and think about, similar to the Michigan alcohol substance abuse test, to kind of figure out, do I have a problem? You can make an appointment with a counselor, or go to the counseling center at SUNY to talk it over, for starters. There's also a lot of self-help programs online and real-time as well. And
so when you say self-help resources, what do those look like?
There's one called Sexaholic Anonymous is one. I mentioned a website called an app called What's Up.
Mm-hmm.
Another one is, I'm looking at my resources right now, if you don't mind.
No, that's fine.
Porn addiction.com.
Okay, so folks could go there and I would imagine both get information but also talk to others who have been through similar addictions themselves and come out on the other side.
The correct address is addictedtoporn.com.
Okay.
And that's a free, the guy who started it, Noah Church, was addicted to porn. So he spends about 20 to 30 hours a week helping people.
Right. Great. Well, this seems like a good resource for listeners if they're potentially at that point where they need more information. So thank you.
You're welcome.
Thanks so much for being our guest. This has been Dr. Neil Cervera, who we've been interviewing here on the Social Workers Radio Talk Show, and we'd like to thank you for being our guest, and we hope you'll come back in the future.
Okay. Thank you very much.
Okay. So we'll be right back in just a few moments on the Social Workers here on WCDB Albany.